Hello everyone, this is Sonu, second year MBBS, Tagore Medical College. So the topic which we are going to deal with today are thoracic duct, Azygos system of vein and thoracic sympathetic trunks, in which thoracic duct and Azygos system of vein are an important short notes. Okay, today's objectives are, we're going to see about the thoracic duct, its area of drainage, extent, its measurements, its formation, course, its tributaries, its relations, and its development. And then we'll see about the Azygos system of veins and then the thoracic sympathetic trunk. First, about the thoracic duct. Okay, so what is thoracic duct? So this thoracic duct is a principal channel for lymph. It's also the largest lymphatic vessel in the human body. So this plays a major role in the lymphatic system. Okay. This thoracic duct also have certain other names called the left lymphatic vessel or elementary duct. Why is it called left lymphatic vessel? Before that, we are supposed to know another point that there is another duct that's called the right lymphatic duct. As the name indicates, now we know that there are two ducts, that is right lymphatic duct and left lymphatic duct. So as per the name, this right lymphatic duct should drain the right part of the body and this left lymphatic duct should drain the left part of the body. But this left lymphatic duct drains almost 75% of the lymph from the body. So what are the area of drainage of the left lymphatic duct? The left lymphatic duct drains all other parts other than the right lymphatic duct. Okay, so what does the right lymphatic duct drain then? Here, this blue color part is being drained by the right lymphatic duct and this yellow parts are being drained by the left lymphatic duct or the thoracic duct. Okay, as we can see here, the right lymphatic duct drains the right side of the head, neck, the right side of the chest wall, and here we would have the right lung and the pleura obviously, and then here we will have the right lung and here we would have the right surface of the liver. Added to this, we'll also have the right upper extremity. Other than this, the whole part is being drained by the left lymphatic duct or the thoracic duct. Okay, as we can see here, the thoracic duct, this is the thoracic duct, this one, we can see it's almost beaded like appearance. Why is it beaded? This beaded appearance is due to the presence of valves that are present inside the thoracic duct. Okay, here, there's another point. Lymph in the thoracic duct is milky white in appearance. For this point to be understood, we are supposed to know why is it called elementary duct. Okay, the thoracic duct originates from the abdomen. So it's called the elementary duct. Since it's originating from the abdomen, this thoracic duct contains the product of fat digestion. So that's called chyle. So the product of fat digestion, as you might have known, it will be milky white in color. So the lymph of the thoracic duct is also milky white in appearance. Moving on to the next slide. As we saw now, the area of drainage. Lymph from all part of the body except the area that are being drained by the right lymphatic duct. So see the right side of the head and neck, chest wall, lung, heart and liver. We'll repeat that slide again. Right side of the head, neck, lung, right side of the heart, liver, and added to that the right upper extremity. Okay, what is it next then? It's the extent of the thoracic duct. The thoracic duct extends from the upper end of the cisterna 𝗂𝗍. So this is cisterna 𝗂𝗍 and this is the point of origin of thoracic duct. Since it is located in the abdomen, the thoracic duct is also called the elementary duct. So the thoracic duct originates from the upper end of the cisterna 𝗂𝗍 on the posterior abdominal wall. So this cisterna 𝗂𝗍 is present on the posterior abdominal wall. What does it correspond to? So its corresponding vertebrae level is T12. Okay, it then courses upward. Where does it terminate it then? As we course this upward, we can see that it is getting terminated in here. What is this then? This is the junction of the left internal jugular vein and left subclavian vein. Left subclavian vein and left internal jugular vein at the junction of the left subclavian and left internal jugular vein. Correspondingly, the right lymphatic duct also empties at the junction between the right subclavian and right internal jugular vein. Okay, now we know its origin, its termination, and its extent. Moving on to the next one. This is the one which we saw earlier. Its measurements. The thoracic duct is around 45 centimeter in length, which corresponds to 18 inches, and the lumen is around 5 millimeter wide. Okay, a point to be noted here is that the lumen is wider at the ends, but narrow in the middle. Okay, so see here, the formation as we saw, it's from the upper end of the cisterna chyli at the level of T12 vertebra. It then ascends in the enters the thorax. Correct? This is the abdomen, but this is the thorax. It ascends and enters the thorax. As we can see here, this is the descending aorta. This is the descending aorta. When it comes here, it will become as abdominal aorta. So this thoracic duct enters into the thorax via the aortic opening of the diaphragm. It then ascends in the posterior mediastinum. Once it reaches the T5 or T4, it crosses the midline from the right side to the left side. Okay, when it crosses from the right side to the left side, it enters from the posterior mediastinum to the superior mediastinum. Okay. Okay. Here, this is the root of the neck. At the root of the neck, it arches laterally. So the root of the neck corresponds to the C7 vertebra. So at the root of the neck, it arches laterally in front of the vertebra, that is the vertebral artery and vein, and the left cervical sympathetic trunk, as we can see here. It then ends in between the left subclavian and left internal jugular vein. Okay, so its course is, it enters the thorax via the aortic opening. It passes over the vertebral bodies in the left side, and then on reaching the T4 or T5, it arches laterally at the root of the neck. And then at T4 or T5, it just enters the superior mediastinum from the posterior mediastinum. And then at the root of the neck at the level of C7, it arches laterally and then ends in between the left subclavian and left internal jugular vein. Okay. The next, its relations. Since we saw it passes through the diaphragm, it passes through the posterior mediastinum, it passes through the superior mediastinum, and it ends at the level of neck. So we have relations at 4 levels. The first one is the relation at the aortic opening. As we saw, it enters through the aortic opening of the diaphragm. So anteriorly, this is the thoracic duct at the right side. Yeah. So anteriorly at the aortic opening, the thoracic duct is bounded by the median arcuate ligament of the diaphragm. What is there at posteriorly? Okay, what's the level of aortic opening? It's a T12 vertebra, right? So the posterior relation would be T12 vertebra. Then onto the right, here we can see the Azygos vein. And then onto the left, we will see the abdominal aorta or the thoracic, descending aorta. Okay. What is it next then? At the posterior mediastinum, At the posterior mediastinum, anteriorly, it would be bounded by the diaphragm, descending aorta, and then esophagus. What is there at posteriorly then? We would have a vertebral column, as we can see here, and the anterior longitudinal ligaments, and then terminal parts of the 𝗵𝒂𝒂𝒂𝒂𝒂 and the accessory 𝗵𝒂𝒂𝒂𝒂𝒂 vein. So these 𝗵𝒂𝒂𝒂𝒂𝒂𝒂𝒂𝒂, this is the 𝗵𝒂𝒂𝒂𝒂𝒂𝒂𝒂 and this is the accessory 𝗵𝒂𝒂𝒂𝒂𝒂𝒂 vein. As you can see, these are behind this is thoracic duct, and these two are behind the thoracic duct. These both drains into the Azygos vein, which you will see in the forthcoming slide. And we will also have the right posterior intercostal arteries. So here we will have the right posterior intercostal arteries. To the right again here, we will have the Azygos vein, and to the left, we will have the descending thoracic aorta. Okay. What's the relation with superior mediastinum then? Anteriorly, we would see this is the thoracic duct. We are seeing from the right side. Okay. So anteriorly, we would have the arch of aorta, and then commencement of the subclavian vein. Which subclavian vein? It's left subclavian vein. Posteriorly, we will have these vertebral columns, and to the right, we would have the esophagus, and onto the left, we will have the left lung and the left pleura. So here we couldn't see esophagus, left lung, or left pleura, but you can see the anterior and the posterior relations easily. So here, this is the anterior relations. This is the brachiocephalic vein actually. It divides, this brachiocephalic vein is formed by the subclavian vein, okay? So subclavian and common carotid. So this subclavian vein is its anterior relation, whereas these vertebral column are the posterior relation of the thoracic duct at the level of superior mediastinum. Okay, relation at the root of the neck. Okay, the root of the neck is the place where this thoracic duct terminates. So anteriorly, we will have the carotid artery, carotid internal jugular vein, and we will have vagus nerve here, which will be surrounded together by the carotid sheath. Posteriorly, since it's anterior to this, we can see thoracic duct being drawn as a dotted line. Posterior to it, we would have the vertebral artery, vertebral vein, and then certain muscle. It's called scalenus anterior muscle. We will also have the thyrocervical trunk. This thyrocervical trunk is a branch of the subclavian artery, and we'll also have the phrenic nerve, which originates from the cervical plexus, which descends downward to supply the diaphragm. Okay, what are the tributaries? What are the tributaries of these thoracic duct? Okay, a point here is that what's the difference between tributaries and branches? So when vessels, some small vessels lead to the formation of a bigger vessel or duct. In case of lymphatics, it's called tributaries. So it's like veins and lymph. The examples are veins and lymphatic vessels. What are branches then? If a larger vessel breaks up into many small vessels to distribute its own content, then it's called branches. So the major example is arteries here. So here we are going to see about the tributaries. Tributaries are for draining the contents from a particular area. So here when we see in the abdomen, okay, so in the abdomen, we will have 6 intercostal, intercostal lymph nodes from both sides. Okay, we'll have intercostal lymph nodes from the both sides. And then what will we have in thorax? In thorax, we have a pair of ascending lymph trunks which drain from the upper lumbar lymph nodes. So see here, these are the upper lumbar lymph nodes and these are the ascending lymph trunks. Okay, the next one, a pair of descending lymph trunks which drain from the posterior intercostal lymph nodes of the upper 6 phase. these descend downwards. These are called descending lymph trunks. What's there again? Lymph vessels from the posterior mediastinal lymph nodes. So as these thoracic duct pass through the posterior mediastinum, we'll also have lymph vessels from those posterior mediastinal lymph nodes. Then next, what do we have at the level of termination or at neck? Here we can see tributaries from the left jugular lymph trunk, tributaries from the left subclavian lymph trunk, and then from the left bronchomediastinal lymph trunk. All these three drain into the thoracic duct at the level of termination or in the neck. Okay, so on the whole, what are the tributaries we have are first, in the abdomen, we will have lower 6 intercostal lymph nodes. And then in the thorax, we have 2 ascending lymph nodes, 2 descending lymph nodes, and also, ascending lymph vessels, descending lymph trunks or vessels. And we'll also have lymph vessels from the posterior mediastinum. And then in the neck, we have 3 lymph vessels. One is from the left jugular lymph trunk. One is the left jugular lymph trunk, and the other one is the left subclavian lymph trunk, and the other one, the last one, is the left bronchomediastinal lymph trunk. Okay, on to the development. There are totally 3 stages of development in this thoracic duct. First, we can see a network of this lymph channels in the fetus. So in front of the thoracic part of the vertebral column, we will have, see, this is the thoracic part of the vertebral column. In front of that, we can see a lymph channel. And then the stage 2. The stage 2 is that we'll have 2 longitudinal lymph vessels, one on the left and the other on the right side. Okay, we have 2 longitudinal lymph vessels. The third stage is that we know that at the T5 or T4 level, we'll say that is T4 because we have more significance at the level of T4. For now, we'll keep it as T4, but obviously there will be some changes in everyone. At the level of T4, the thoracic duct crosses from the left side to the right side, and it also enters the superior mediastinum. Thoracic duct crosses the right side from the left side, and it also crosses the superior mediastinum from the posterior mediastinum. So above the level of T5 or T4, the thoracic duct of the right side degenerates or disappear. And below the level of T4 or T5, the thoracic duct of left side degenerates or disappears. So now we can just course along this. This is the original course of the thoracic duct we know. Okay. The next thing is the clinical correlations. Okay. What would happen if the thoracic duct is being injured? The thoracic duct will be milky, the lymph content will be milky white in color when we take fat meals. But during surgery, this thoracic duct may be damaged or injured since it is colorless sometimes. Okay, so what does that cause? That causes chylothorax. What is chylothorax then? So this presence of this lymphatic fluid in the pleural space of the lung because of the leakage from this thoracic duct or from any one of its tributaries, that's called chylothorax. So what are the causes of this chylothorax? One, we saw that during surgery, the thoracic duct may be unintentionally be damaged. The other things are blunt trauma to the chest, and then some penetrating injuries like gunshot or stab injury, things like that. The next one, obstruction to the thoracic duct. So when this thoracic duct is being obstructed, the lymph will have no other space than to flow into other areas. So what are the other areas and how it is obstructed? We'll see that. So during filarial infections, as we know, elephant lung, it's called by 𝗬𝗓𝗏𝗃𝗃. So it's caused by microfilarial parasite. So that causes chylothorax, chyloperitoneum, chylurea, and chylocele. So chylothorax, as we saw, it's the presence of lymphatic fluids in the pleural space. What is chyloperitoneum then? We have a space in stomach called the peritoneal cavity. So this chyle or the lymph vessels with this chyle may enter the peritoneal cavity. What is chylurea then? The chyle reaches the kidney and then the urine becomes milky white in color. So the urine contains chyle. So that condition is called chylurea. What is chylocele then? In testis, we have three coverings, three layers of covering of the testis. So the outer layer is called tunica vaginalis. So in between that, in the tunica vaginalis, we have two layers, parietal and visceral layer. In that, if the chyle is being accumulated, that's called chylocele. With this, we complete the thoracic duct. We'll move on to Azygos and 𝗵𝒂𝒂𝒃 system. Okay. Azygos system of vein obviously contains Azygos, 𝗵𝒂𝒂𝒃, and accessory 𝗵𝒂𝒂𝒃 veins. So these three veins form an H-shaped configuration. So what is the location of this Azygos vein? It's on the right side in the upper part of the posterior abdominal wall and the posterior mediastinum. And seeing the image, it will be very easily accustomed. So here, this is the Azygos vein. So as we can see, its position is on the right side in the upper part. This is the posterior abdominal wall, obviously, but this is the upper part of the posterior abdominal wall and in the posterior mediastinum. Since it is located proximal to these vertebral column, it will be obviously the posterior mediastinum. Okay, this is the Azygos vein. Then where is 𝗵𝒂𝒂𝒃 and accessory 𝗵𝒂𝒂𝒃 vein? This is the 𝗵𝒂𝒂𝒃 vein. This is the 𝗵𝒂𝒂𝒃 vein, and this is the accessory 𝗵𝒂𝒂𝒃 vein. Now, as we see, this almost forms an H-shaped configuration. Okay. Moving on to the next slide. This Azygos vein connects the inferior vena cava and the superior vena cava. So this Azygos vein may contain many valves. Since it drains the blood from the lower extremities to prevent the backflow, it may contain many valves. So these valves give a tortuous appearance to these Azygos system of veins. Okay, what are the functions of this Azygos vein? As we know, it connects the inferior vena cava and the superior vena cava. It forms a collateral channel connecting the superior vena cava and inferior vena cava. Then it drains the venous blood from the thoracic wall and the upper lumbar region. As we saw, it's in the posterior abdominal wall, so obviously it will drain the blood from the thoracic wall and the upper lumbar regions. Okay. We'll see the formation, course, and termination of these three Azygos, 𝗵𝒂𝒂𝒃, and accessory 𝗵𝒂𝒂𝒃 together. Before that, we'll see just some short introduction points about these 𝗵𝒂𝒂𝒃 and accessory 𝗵𝒂𝒂𝒃. So what is 𝗵𝒂𝒂𝒃 vein then? 𝗵𝒂𝒂𝒃 vein, also known as the inferior 𝗵𝒂𝒂𝒃 vein, as its name indicates, it's present on the inferior part. Where is its location then? It's located on the left side only, and it corresponds to the lower part of the Azygos vein. We'll go to the previous slide once. Here, this is the 𝗵𝒂𝒂𝒃. Yes, this 𝗵𝒂𝒂𝒃 is a mirror image of the lower part of the Azygos vein, and it is called the inferior 𝗵𝒂𝒂𝒃 vein. Yeah, because it's present inferior. Whereas this is called accessory 𝗵𝒂𝒂𝒃 vein. It's also called the superior 𝗵𝒂𝒂𝒃 vein. It's a mirror image of the upper part of the Azygos system of vein. Sorry, Azygos vein. Yeah, it's also called the superior 𝗵𝒂𝒂𝒃 vein. It's on the left side only, and it corresponds to the upper part of the Azygos vein. So it's the mirror image of the upper part of the Azygos vein. Now we'll see the formation, course, and termination. First, we'll see the formation and course of the Azygos vein. So the Azygos vein formation is very variable. So it can be formed in many ways. First, it is formed by the union of the right subcostal vein. What is subcostal vein? Subcostal vein is the 12th intercostal vein. Since it supplies the stomach, I mean the diaphragmatic area or the abdominal area, we call that as subcostal vein or subcostal nerve in case of intercostal nerves. So the first type of formation is, it is formed by the union of right subcostal vein and right ascending lumbar vein. So this formation is at the level of T12. So this formation corresponds to the level of T12 vertebra. The next type of formation is, it arises from the posterior aspect of the inferior vena cava near the renal veins. Since this is the renal veins here, near that, it may also arise from the posterior aspect of the inferior vena cava. The next thing, it may arise directly as a continuation from the right subcostal vein. And then it may also arise from the right renal or the right first lumbar vein sometimes. Okay. What is the course? The Azygos vein, once it is formed here, it ascends upwards and it leaves the abdomen by passing through the aortic opening of the diaphragm. So the course is almost similar to the thoracic duct up to the level of posterior mediastinum. So as we know, the same thing, it passes through the aortic opening of the diaphragm, it reaches the posterior mediastinum, and then it ascends vertically, lying in front of the vertebral column. So the vertebral column is just backside, I mean it's behind the Azygos vein. So here it reaches the T4 level. So this is the level of T4 vertebra. At the level of T4 vertebra, the Azygos vein arches in front. It arches over the hilum of the right lung. So while learning lungs, you might have seen the relations of the right lung, that is the mediastinal relation. You might have seen the arch of Azygos vein here. So this arch causes the impression of the arch of Azygos vein over the right lung there. So it arches and it terminates into the superior vena cava. So this is at the level of T4 vertebra. And then what's the level of costal cartilage? Then it's at the level of second costal cartilage. Okay. Okay. Next, we'll see about the tributaries. Before seeing tributaries, it's better that if we see 𝗵𝒂𝒂𝗃 and 𝗵𝒂𝒃 vein. So what is 𝗵𝒂𝒃 vein then? What's the formation of 𝗵𝒂𝒃 vein then? The 𝗵𝒂𝒃 vein formation is very similar to that of the Azygos vein. See, it might be by the union of the left ascending lumbar vein and left subcostal vein. It may arise from the posterior surface of the renal vein. Since it arises from the renal vein directly, it won't arise from the inferior vena cava. There's a reason behind that. And then its course. This 𝗵𝒂𝒃 vein, once it forms, it courses upward, it pierces the left crest of the diaphragm and it ascends vertically in front of the left side of the vertebral column, and then it reaches the level of T8. So this is the level of T8. So this is T4, this is T8, and this is T12. So once it is formed, it courses upward along the vertically in front of the left side of the vertebral column up to the T8 vertebra. So see, this is T8 vertebra level. It turns into right, it crosses in front of the vertebral column, and then it just drains into the Azygos vein. So the tributaries of this 𝗵𝒂𝒃 vein would be The lower 3 intercostal, posterior intercostal vein, that is 9, 10, and 11, and then left subcostal vein, left ascending lumbar vein, and some small esophageal and mediastinal veins. Okay. Now we'll see the accessory 𝗵𝒔𝒂𝗃 vein. The accessory 𝗵𝒔𝒂𝗃 vein begin at the medial end of the 4th or 5th intercostal space. Okay, it then descends to the left side of the vertebral column. It reaches the level of T8. It just turns to the right. It passes in front of the vertebral column behind the aorta and the thoracic duct. It then drains into the Azygos vein. Okay, what are the tributaries of this accessory 𝗵𝒔𝒂𝗃 vein? Then it's 5 to 8 posterior, left posterior intercostal veins. Sometimes this accessory 𝗵𝒔𝒂𝗃 vein may also, left bronchial vein may also be a tributary of this accessory 𝗵𝒔𝒂𝗃 vein. Okay, now we'll see about the tributaries of the Azygos vein. The lower 7 right posterior intercostal veins, 1, 2, 3, 4, 5, 6, and 7. So these lower 7 right posterior intercostal veins, and then right superior intercostal vein. What is right superior intercostal vein? It is formed by the 2, 3, and 4th right posterior intercostal vein. What are the other tributaries then? The major tributaries would be 𝗵𝒔𝒂𝗃 vein and accessory 𝗵𝒔𝒂𝗃 vein. We'll also have right subcostal vein, right ascending lumbar vein, and then we'll have right bronchial vein from the right lung, mediastinal veins, pericardial veins, and esophageal veins. Okay, what's the clinical importance of this Azygos vein? In case of obstruction of the superior vena cava, since this Azygos vein connects the superior vena cava and the inferior vena cava, it serves as a collateral channel for the blood from the upper part of the body to the inferior vena cava. Okay. Okay. What are the relations of the Azygos system of vein? So anteriorly, this is esophagus. So it just extends here. Sorry, it just extends here. So this anteriorly, this Azygos vein will be bounded by the esophagus. Esophagus, particularly the right edge, as we see here, when it extends down, the right edge of the esophagus will be its anterior relation. Posteriorly, we can see that 8 thoracic vertebrae. Since it drains, it arches over the level of T4, there will be 8 thoracic vertebrae, T12 to T4. And then right posterior intercostal arteries. Then to the right, we'll have right lung here surrounded by its pleura. And to the left, we'll have the thoracic duct, descending thoracic aorta, and the right border of the esophagus. Okay. With this, we have completed the Azygos system of vein. The next thing is thoracic sympathetic trunk. Okay, what is thoracic sympathetic trunk? These are, as we can see, these are the sympathetic trunks. When we see, we can see some beaded ganglion-like structure. Yeah, it's ganglion. So, this thoracic sympathetic trunk is a ganglionated chain which is situated on the either side of the, this is the vertebral column. So, this ganglionated chain is located on either side of the vertebral column. Okay. So what is its connection? Where does it extend from? As we are saying thoracic, it should be confined to the thoracic region. So above here, this thoracic sympathetic trunk extends, it's continuous with the cervical sympathetic trunk above, and below inferiorly, it is continuous with the lumbar sympathetic trunk. Okay. See, it's ganglionated chain on either side of the vertebral column. Superiorly, it is continuous with the cervical sympathetic, and inferiorly with the lumbar sympathetic. Okay, what is its course then? It descends in front of the neck of the first rib, head of the 2nd to 10th rib and along the bodies of the T11 to T12 vertebrae. Okay. It passes in front of the posterior intercostal nerve and vessel, and then behind the median arcuate ligament. See, it passes behind the medial arcuate ligament. This is the medial arcuate ligament. It passes behind the medial arcuate ligament. And then in front, I mean, we'll have posterior intercostal arteries at the posterior part of the intercostal space. In front of that, we'll have the sympathetic trunk, I mean, thoracic sympathetic trunk here. Okay, we'll see about the ganglia now. As we saw, there are many ganglionated structures here in the thorax. Okay. How many ganglions are there? What are the names of the ganglion and how are they related? Where are they located? We'll see that now. So, there are 12 ganglia. So, these 12 ganglia correspond to those 12 spinal nerves. So, the first ganglia fuses with the inferior cervical sympathetic ganglia. So, when it fuses with the inferior cervical sympathetic ganglia, it's called cervicothoracic ganglion or stellate ganglion. Okay. Where are these ganglions located? When we see here, this is the vertebra, this is the vertebra. In between that, we will have intervertebral disc. So, these ganglion lies at the level of corresponding intervertebral disc. So, these ganglion are connected to its corresponding spinal nerves via gray rami communicants and white rami communicants. Okay, we'll see that. See, this is the gray rami communicants and this is the white rami communicants. This is the corresponding spinal nerve. What are gray rami communicants and what are white rami communicants? Gray rami communicants are postganglionic fibers. So, we'll take an example. This is supposed to be sun. For example, when we go into sun and when we return home, we'll be tanned, right? So, while going into the sun, before going into the sun, we are not tanned, like we are very bright. So, it's white rami communicants before going into the ganglion. So, before going into the ganglion, there will be preganglionic fibers here. When it reaches, when it comes out of the ganglion, there will be postganglionic fibers there. Since it is very tanned, it's also called gray rami communicants. It's just an example there. Okay. The next thing we're going to see is branches. It's very simple. So the thoracic sympathetic trunk has medial branches and lateral branches. This medial branch supply the visceral organs. So the medial branch we'll divide that medial branch by 1 to 5 fibers and then from 5 to 12 fibers. So the postganglionic fibers of 1 to 5 ganglions, thoracic sympathetic trunk, forms many plexus. Okay, what are these called? We have formation of cardiac plexus, pulmonary plexus, aortic plexus, and esophageal plexus. All these are formed by the postganglionic fibers of 1 to 5 ganglia of the medial branch of the thoracic sympathetic trunk. Okay, then what does the preganglionic fibers of the 5 to 12 thoracic ganglia does? These preganglionic fibers of the 5 to 12 thoracic ganglia will be divided into 3 parts, 3 splanchnic nerves. Splanchnic nerves, as we know, splanchnic means it supplies the viscera. As we know, this medial branch overall supplies the viscera. Splanchnic, as its name indicates, it supplies viscera. So, it will be divided into greater splanchnic, lesser splanchnic, and least splanchnic nerves. As these names indicate, the nerve distribution also varies according to this. Greater splanchnic nerve is formed by the 5th to 9th ganglia, whereas this lesser splanchnic nerve is formed by the 10th and 11th ganglia, and the least splanchnic nerve or the lowest splanchnic nerve is formed by the 12th ganglia. What does these supply? The greatest splanchnic nerve supply the crest of the diaphragm. It reaches the this greater splanchnic nerve, once it reaches the crest of the diaphragm, below the diaphragm we have abdomen. So at the abdomen we have a ganglion. It's called celiac ganglion. So this greatest splanchnic nerve terminates at the level of celiac ganglion. So sometimes or partly, some part of this greatest splanchnic nerve also terminate at the aortico-renal ganglion and suprarenal ganglion. Okay, what is this lesser splanchnic nerve does? This lesser splanchnic nerve also terminates in the celiac ganglion. Actually, its course is very similar to that of the greatest splanchnic nerve. It also terminates at the level of celiac ganglion. Okay. What is these least splanchnic nerves or lower splanchnic nerve does? It's also called renal nerve. Since its name indicates, this supplies the renal or kidney. This may be sometime be present or absent, since the greater and lesser contribute to the major part. This least splanchnic nerve or lower splanchnic nerve is not present at all times. Okay, where does this terminate then? This least splanchnic nerve terminates at the renal plexus. You see a diagram. Okay, see, these are for the formation of plexus. These things are the postganglionic fibers of the 5 to 12 ganglion. This is the greatest splanchnic nerve, this is the lesser splanchnic nerve, and this is the least splanchnic nerve. As we see here, the greater and the lesser splanchnic nerve ends at the celiac ganglion, sometimes also the suprarenal ganglion. The renal ganglion or the renal plexus is not that much very prominent or very important as that of the greatest splanchnic nerve or lesser splanchnic nerve. Okay. What does the lateral branches do now? These lateral branches are for the somatic, it provides somatic innervation. So these supply the limbs, body wall, and muscles, things like that. Okay, so what does it supply? It supplies the supply is pilomotor, pseudomotor, vasomotor to the skin of these regions. Okay, so the preganglionic fibers arise from the lateral horn of the spinal segment, and they enter the sympathetic ganglion via white rami, and it leaves as gray rami, as we saw earlier. Now, clinical correlation. Okay. The first one is thoracoabdominal sympathectomy. What a sympathetic nervous system does is it increases the blood pressure in a cardiovascular system as far as now. So why do they do thoracoabdominal sympathectomy? Means it is to relieve the severe hypertension. So once these bilateral sympathectomy is done to relieve the hypertension, the sympathetic the sympathetic nervous system, it's totally excised, so that only vasoconstriction is present, there will be increase in blood pressure. But when this sympathetic nervous system is totally removed, there will be vasodilation and there will be fall in blood pressure. So this thoracoabdominal sympathectomy is used to relieve severe hypertension. Okay. They also use upper limb sympathectomy to treat Raynaud's disease. Okay, what is Raynaud's disease? Raynaud's disease is nothing but the finger, toes, and extremities now, they feel very numb and cold in response to some cold temperature or stress because of the constriction or because of the vasospasm. So if the sympathectomy is done, it causes vasodilation, as we have seen earlier. So when this vasodilation occurs, there will be free flow of blood, so that the extremities will be supplied with oxygen rich blood. The next one, injury to, sometimes injury to the stellate ganglion, or we first ganglion, when it is fused with the inferior cervical ganglion, it causes Horner syndrome, ipsilateral Horner syndrome. What is Horner syndrome? Horner syndrome is something that happens when cervical plexus is damaged or any lesions occur in this cervical plexus, which we will see that in head and neck. So what are the symptoms, or what happens in Horner syndrome? The pupil becomes smaller and there occurs ptosis. Ptosis is nothing but drooping of the upper eyelid, and there also occurs anhidrosis. Anhidrosis is absence of sweat in the face. So when this injury, stellate ganglion is being injured, the same side, if the right side of the right stellate ganglion is injured, the right side of the face will have all these symptoms or all these things that happen in Horner syndrome. The next one is sometimes there occurs hypotension, because during spinal anesthesia there occurs paralysis of the paralysis of the sympathetic trunk. So that causes increased blood flow, or it dilates the blood vessel, and that causes hypotension of the hypotension generally occurs of the blood. Yeah. Thank you.